Hey guys, Tony Maritato here, licensed physical therapist, and today I'm talking about the Pure PT stretch strap. So this is by far my favorite stretch strap for patients who have had a total knee replacement, who need a strap to either help lift the leg in and out of bed, use a strap to help with heel slides and passive knee flexion stretch. I'm going to show you each of those three things now. The reason why I like this Pure PT stretch strap so much is it's extra long, so you can use any of these loops for better leverage. It's very soft material, and it's a nylon that allows it to slide around any kind of lower extremity. Like if I have a sock on my foot, it's really easy to adjust. It doesn't grab or catch or pull or tear the skin. So typically, patients after a total knee replacement, they're going to have a hard time lifting the leg in and out of bed. I'm going to show you here, if I'm sitting at the edge of my bed, I can use my strap, I loop it around my foot, I bring my non-surgical leg in, and I use this to bring the surgical leg in. Now, from this position, if we're going to do a heel slide exercise, what you're going to do is you're going to put the loop around the foot. We're going to grab any of the extra loops to get a little better leverage, and as I slide my foot back, I'm getting a knee bend, which is knee flexion, to the point that I feel the pressure, but not to the point of pain. I'll hold this position 5 to 10 seconds, and then I'll let it come back down. We would repeat this typically 10 to 20 times, 2 to 3 episodes per day. But the whole goal in this is to use the strap to assist, get a little extra knee flexion each time you do this exercise. Then the last one that I like is what I call a passive knee flexion. So to do this, I put the flat part of the strap behind my lower leg. I can lay back, and as I bring the leg up, what I would typically do is grab the loops closest to where the strap is crossing the back of my leg. I hold it, I allow gravity to pull the leg down. Once I get to the bottom of the available range of motion, I might do a series of bounces, or I might just try to relax and allow gravity to pull this into flexion. If my arms get tired, I can loop the strap right around my elbows. I crisscross my hands over my shoulder, and the same thing now. All I'm doing is letting gravity pull down. I can do a couple bounces. I can just let it sit and rest. 20 to 30 seconds. I lift it to take the pressure off, or I can let it down. And I would repeat this stretch 3 times, and I would do it 3 episodes per day. So these are usually done during the first week of post-surgical recovery, day 1 to day 7, maybe to day 10. Depending on how your range of motion is progressing, there's more advanced exercises you could be doing, which I'll show you in a separate video. But if you have any questions, post them in the comment. Thanks for watching.